We read in the papers today that the Edo State Governor has come up with a policy to encourage COVID-19 vaccinations, and the expectation is that it will now become compulsory for everyone in the state to carry an indication that they've been vaccinated before they can attend public events like your church, like your mosque, schools, the offices. It will be compulsory within Edo State for everyone to get vaccinated. This is their own way of ensuring that they reduce mortality within their state due to COVID-19. Now, some people are now saying that, okay, we know you want to protect us, but we're not interested. We should have freedom of right to choose whether we want to live or we want to die. And some are saying that the government is pushing it too far, that even other countries that have recorded high number of deaths haven't made it compulsory for every citizen to get vaccinated. So the question is, what are your thoughts on this? Do you believe this is a welcome development to encourage to make vaccination compulsory? Or would you agree that people should be given freedom to decide whether they want to get vaccinated or not?
I think our governments are always in a hurry to just reel out these policies. So they just, okay, how do we get these people to comply? And the first thing that comes into their head is usually force. But you need to understand the sort of people that you have, the sort of people that you are leading. Let me not use the word rule, but we know how it is. The sort of people that you are leading, you need to come down to their level so that everybody is carried along. So what are some of the measures that you have put in place to carry them along? Like you mentioned, going to the villages. What are some of the sensitizations that you have done? How have you promoted jingles? How have you gone to the marketplaces to speak to them so that they even understand? A lot of people still, till today, have issues with taking the vaccines. They still have the conspiracy theories. They are still asking if the, what's this?
Is magnetic.
If it's magnetic till today. That means that we have not done enough to educate them on the benefits of vaccinating them. So if you now come up with, okay, if you're not vaccinated, you'll not be able to do this, how do you even plan to enforce it? Because the truth is, it will definitely be abused.
The reason I don't see anything wrong with asking that people must be vaccinated. So it's not that you must all be vaccinated. It's that, well, if you need to go to church, be vaccinated.
If you want to go to the party.
If you want to go to the party, be vaccinated. So if I want to be vaccinated, I go and get my vaccine. Simple. So it's not really a, if you are not vaccinated, then we'll lock you up in prison,
like
whatever.
Saying that, you know, me, I'm vaccinated, so I can go to parties. I've already been vaccinated.
Okay, yeah. So when you do that, because one thing with vaccination is that when those unvaccinated are more than those vaccinated, the effect of it is, yes, you don't get that immunity, that herd immunity. So for a lot of other vaccines that people do not want to be, that a lot of people have sort of taken themselves out of, especially with children's vaccines, is that in that situation, we have more children vaccinated, more people have the vaccine, so you enjoy that herd community. But this is what we're trying to build in Nigeria, in Edo State.
Some people, for religious reasons, do not want to get vaccinated. But it shouldn't. And how does this contravene their individual human rights to say, I don't want to get vaccinated?
There's of course a clash of people's rights to do things freely, to choose what they want. This is something that will be applied on the person. And I think without legal backing, the governor cannot just say, you can't, you must take it to carry a card. Yes. How many vaccines do we even have? Wait. In Edo State, how many vaccines were they given? What's the population of Edo State? How practical exactly? Are you just trying to restrict people's movement by using an excuse, or you truly, truly want them vaccinated? For people to get vaccinated, I support. But to compel and restrict their movement to carry a card, I see too many abuses. And this is what I expect to be well done, something that will be well thought through, holistically put together. People have the right to choose to take it or not. Yes, and you can say, okay, if you don't have access card, there are certain places you can't come. But when it clashes with their right to enter that place or use that place, there will be issues.
The developed countries are not still doing that now.
I understand people's rights, but if your right to not take the vaccine would affect my child, your own child coming to affect my own child in the same school as just because people have refused to take the vaccine. Please, I'm not going to take that either.
There are non-invasive procedures. Wait, hold on a minute, Miriam. There are non-invasive procedures already given as guidelines.
Like wearing of those masks.
Compel people to wear face masks. How have you enforced that already? Compel people to sanitize. How many hand washing centers have you provided
in Edo
State? There are many farming communities within Edo State. How many have you done? So that when we are talking, and let us not just be like we're just, you know.
Margaret Oguntola said, good morning, sisters. Please, have we got enough vaccine to go around before enforcing? Lola Lawal Adeumi says, no government should have the right or power to force anybody to take vaccines whose long-term effect is not yet known. This is wrong on all fronts. How many vaccines have ever been forced on people? Why is this one being forced? I should have a right over my body. What of those who get side effects? Will the government take responsibility for side effects for people who have not had the COVID since all the noise?
Very important question. We have Dr. Tuyime Bawodu, who is a public health expert, who is going to tell us more about if he feels this would work and how best to implement this policy. Dr. Tuyi, good to have you again on the show. Good morning. I hope you've read about this new policy that Edo State wants to roll out by the second week of September. Do you agree with it? Do you believe that this compelling system would be a faster way to get vaccination to increase?
We just have to use some extraordinary measures to ensure that people comply with the vaccination. Why do we have to use this? Because look at all the non-pharmaceutical intervention that we have pushed. Wear face mask, social distances, avoid crowd, wash your hands. People think that those things are just manufactured from somewhere. They are not complying. And of course, the only thing left for us actually to do is to deploy vaccines as much as possible. I had argued in the past and over again that what we need to do is to ramp up vaccination. We need to actually look for the vaccine and give those vaccines. Now it becomes important that if you have vaccines and you're giving that vaccines, then we have to implement ways to ensure that you don't endanger the lives of other people who chose to vaccinate themselves and who chose to run away from crowd.
How about frontline workers being vaccinated, that were compulsorily vaccinated initially? Is that not enough to improve herd immunity?
No, we don't have enough doctors now.
I mean, for the case of Edo State.
Again, frontline, listen, for you to get herd immunity, you need to move as much as 60% of the population vaccinated. 60%. You know that the first vaccines that came up was about how many was just about less than 4 million.
Yes.
The people that took these 2 doses were less than 2 million. Okay, so in the whole of Nigeria, how is that going to produce herd immunity? First of all, we have massive vaccine shortage. 2% of the population has just been vaccinated. That is nothing. That is, it's not something we should be proud of talking about.